So we are so excited to have Dr. Rubio here today from UCSF, and we have some questions. We have both the podcast club here and members of the newspaper, and so they are going to ask Dr. Rubio some questions that we've compiled from students and teachers and staff across ICA Cristo Rey. So I will give it over to the students who have some questions. Thank you so much for meeting with us.
Thank you. Thank you all for having me.
So the first question I have is it possible to receive COVID even with the mask on?
So it is still possible. Nothing is, 0% in terms of transmission, but it all depends on the situation of, when you're in contact with somebody who may have COVID-19. As we say, if two people are unmasked and one of them has COVID-19, that's a fairly, high risk scenario for the other person to get COVID-19. Now, if you kind of go down the route of, well, if the other person who doesn't have COVID have a mask on, the risk is not as high, but it moves a little bit lower for that person to be able to get COVID-19. And it depends on the mask that you're wearing too. So as you all are familiar with, we've kind of evolved with the masks that we've been using. Initially it was, any mask is okay. Cloth is like probably the one that doesn't provide the most protection, given that, particles can still get through a cloth mask. The next mask is a surgical mask, which may be a little bit more tightly woven, so filters out more particles. And then you have your highest grade masks, which are like the N95 or the KN95 that you may see around, and that filters up even more. The 95 meaning that it filters out, about 95% of things coming through. So, none of them are 100%, so things can still get through the mask. But if, we take it down to the next level, where if somebody wears a mask who has COVID and the other person who doesn't have COVID wears a mask, then the risk is lower because, the person who has it, they will have a barrier from their nose and mouth to be breathing it out. And then the other person who is masked will, be further protected with the mask that they have on. So kind of lowering the amount of virus that is able to get from one person to another. So still possible, but much lower risk in using masks, which is why we, eventually got to the point in saying that, we should all wear masks, especially in indoor settings, such as restaurants, meetings, and then, even in some cases when transmission has been so high, even to wear it outside or in crowded places outside. So that's in summary, still possible, but we would still recommend using the mask because it lowers the chances much more. And of course, we may get into this a little bit later, vaccination also helps protecting you from COVID with the mask as well.
The next question I have is, when is someone who has COVID the most contagious?
Yeah, that is a very highly debated topic. So we can talk about it in terms of, what happens when somebody first gets COVID, right? Say if I were exposed to somebody who had COVID, usually the amount of time that a virus takes to replicate in somebody is what we call the incubation period. And, our best estimate of that incubation period for COVID-19 is about, a couple days or so for then you to have, symptoms and then be contagious to other people. But what is also important is that even before you develop symptoms, you have probably gotten to the point where there's enough virus replicating that you can transmit it to other people. So that's why when we ask patients, who develop symptoms of COVID-19, we ask them in the past, 48 or 72 hours, notify anybody that you've been in contact with, because that's probably when they were contagious to them during that time. So I would say in summary, probably the most contagious you are when you have, or most contagious is, when you have symptoms, but also a couple days before that. And it's also important to know that some people don't even have symptoms. They may get tested because they had contact with somebody with COVID-19, or, they needed for a procedure, or, what have you, and they'll be positive without any symptoms. And even those people who are asymptomatic can still be infectious to others. So I usually use symptoms as kind of a guide of, how contagious somebody could be to others, but which is why it's important when somebody does develop symptoms to, test quickly, using a rapid test if possible, so that you can know right away. And also, because that will help you decide if you should notify people, that you had contact with the first 2 days or the 2 days prior, but also getting yourself into isolation.
And the next one I have is, can you explain the new changes from 5 days from 7 days?
Yeah, absolutely. So again, another very highly debated topic. So overall, the reason for the change from 10 days previously to 5 days is because after, the CDC reviewing a lot of data and information of when people are contagious or how long people are contagious, they saw that, by day 5, most people are no longer contagious to others. There is some debate about that, which is why here in California, we still recommend getting another test after day 5 to make sure that you're now negative and not contagious to others. That kind of extra negative test kind of reassures people that, you're not going to be contagious to other people. But, previously in the pandemic, it had been 10 days, mostly out of precaution. We had suspected that, the amount of time that a virus is in your system is about 14 days or so. And if we do the math, it takes about 3 to 4 days to develop symptoms. So that's kind of like when your symptoms start. And then you isolate for 10 days. In total, that's about like 14 days total of how long the virus has been in your system. So initially it was 10, but then the CDC reviewed information, and now, with the data they have, they think that, 5 days is probably sufficient for the majority of people. That's still being debated right now, but overall, they think that less isolation is safer now. We're also in a different period of the pandemic, early on when, the majority of people hadn't had COVID, were not vaccinated. I think it probably was important to extend the isolation a little bit longer because you want to contain the spread of COVID-19 in the population. Now it may be a little bit different because now, fortunately with the vaccine, a majority of us are now vaccinated and have some protection against COVID-19 in that way, and using masks as well. So again, the main reason is that new information showing that possibly after 5 days from having symptoms, you're no longer contagious to others. What I tell my patients is, I still like them to do that second test, especially if it's somebody who's working in a high risk setting, such as, if they're working in a school or, a daycare, or taking care of patients or taking care of others who are vulnerable. I think that it's probably wise to get that second test to make sure they're negative before going back.
One question that I have is someone with symptoms more contagious than someone without symptoms? And how can I tell if I'm asymptomatic?
Yeah, I think in general, people who are having symptoms, the way I like to think of them is that they're probably having a lot more of the virus replicating and causing those symptoms. COVID-19 tends to replicate more, in the nose and the throat and in the lungs. So if you're having a lot of replication there, then there's going to be a lot of, inflammation causing you to have those symptoms, right? Our symptoms are more from our body responding to the virus. So you're going to have, coughing, shortness of breath, congestion. There are other symptoms you can have too, like fever and such. So I would say, generally speaking, not, entirely, true. Asymptomatic people can still be as contagious as symptomatic people, but I would say if you're having symptoms, then you're likely to be very contagious to others, which is why it's important to isolate. And then how can you tell if you have infections, if you have an infection when you're asymptomatic. So that's a really tough question because, if you're not having symptoms, then, you don't really have a reason to suspect that you have COVID-19. I would say if you don't have symptoms, reasons to test are, as I mentioned before, is that if you were a contact of somebody with COVID-19 recently, would definitely try to get tested, for example, over the holidays, if people were had like a lot of get-togethers or traveled, I think there are moments that, or maybe just to backtrack, I'll use an example of myself. I did travel back home for the holidays. So before I left, even though I didn't have symptoms, I wanted to be sure that I didn't have COVID. So I took a rapid test to make sure that I was negative. I did sort of get-togethers at home. So when I flew back, I took another test. And then when I got back to work, I took another test as well. So I think, it's all about, if you're having a get together with other people, if you're traveling, if you take care of other people at home, or if you have family members at home who are, vulnerable to COVID-19 and you don't have symptoms, I think getting a regular test, would be reasonable to make sure that you don't have it and are asymptomatic and are passing it to other people. Or if you were, again, a recent contact, making sure that you test after that contact to make sure that you did not get COVID-19.
And another question is, what are other symptoms that can come from having COVID? And can you be more susceptible to things such as diabetes, cancer, or mental health disorders?
Yeah, so I think other symptoms of COVID, so we talked about mostly the respiratory ones, given that, COVID-19 is mostly a respiratory sort of viral illness. We talked about fevers, fatigue, just feeling tired, not feeling quite yourself, myalgia, so a lot of like muscle aches and pains. Again, that's kind of a inflammatory response that your body makes, making you feel, overall crummy. And then other symptoms, in terms of like other conditions, having COVID-19 itself doesn't necessarily mean you will be more likely to develop those conditions that you mentioned, the diabetes, cancer, other things. But I think we're also very early on in the pandemic. I know it seems like it's been forever, but we only have about 2 years of information of COVID-19. We started this about, or maybe even a little less than 2 years ago for here in the United States. So this is going to take time to learn a little bit. I will say that a lot of people did realize they had other medical conditions at the time they were diagnosed with COVID-19. And that is a very kind of complicated question to answer, because I think a lot of people who were negatively impacted by COVID-19, or disproportionately impacted, I should say, were people, of color. So people who were, African American, Latinx, Southeast Asian, who may have, both COVID-19 experienced barriers to care, to see a regular doctor for regular checkups. So really the first time they go to the hospital when they develop COVID-19 is the first time they see a doctor in the first place. And then, boom, right there, they find out that they have diabetes, that, that they are, overweight and causing them to have a really bad illness of COVID-19. And, I've even had some cases where, patients coming in with COVID-19 and they had, shortness of breath for a long period of time, and they finally saw a doctor and they found out that they did have, lung cancer. So I think it's a lot of people who, probably didn't have a lot of access to healthcare. And it was really in a time of crisis when they had COVID-19 that they saw someone, and then they found out that they had other conditions. So that's kind of like an association, not because of COVID-19, but probably because of other structural barriers and structural racism that exists, unfortunately in our society, that didn't allow these people to get into care sooner. So it was probably a lot more than what you all wanted to hear, but it is kind of a very important topic that we need to continue to address after the pandemic. And then in terms of, are you going to be at risk of other conditions in the future? I think it remains to be seen. There is long COVID that we're still continuously learning about. I think we are seeing that in people who experience symptoms of long COVID, it does seem that they do have some neurocognitive effects afterwards, kind of just trouble with concentration and memory, which we're still actively learning about. People who had really, severe COVID from a lung perspective may have some residual lung scarring and issues afterwards as well. Some people who have needed lung transplants afterwards. So I think we're still in that early phase of seeing what it means to have COVID-19, in the long term.
If someone who takes pills such as antidepressants, are they at a greater risk if they do come in contact with COVID?
That's a great question. So overall, if somebody is on medications like antidepressants, I would say that they are not at higher risk of developing, COVID-19 or severe COVID-19. There was an interesting study that there was one specific antidepressant called fluvoxamine that actually showed that people actually did better who took this medicine at the time that they got COVID-19, which is really interesting. There's some interesting studies that show that this, cheap medicine may actually help with COVID-19. It's still not fully recommended at this point. Even though, as you all know, with the medical care system, with advancement, you want to see repeated success of a treatment before recommending it to everyone. So I think we're still waiting to see that for this medicine. But I would say that there's no increased risk if somebody's on antidepressants, and who knows, even if you are on fluvoxamine, may actually be in a better spot to prevent severe disease.
How many times can you get COVID, and how will it affect your health and immunity after COVID?
Yeah, great question. So in terms of reinfections, usually what I like to say for folks is that after they get COVID-19, immunity from an infection itself lasts about 3 months, which is why some of you may have heard that, after you get COVID-19, that you don't have to retest for COVID-19 again in a 3-month period, because you are probably, highly protected from the recent infection that you had. So that's kind of natural immunity. And really, in terms of how many times you can get it, I've definitely seen folks get it, again, once. And it really depends on how much the virus changes. And because if the virus keeps changing, then maybe your immunity that you had before won't be as protective. Such as with Omicron, the spike protein on Omicron changed significantly to the point that there are antibodies made from natural infection and even from vaccines, it was able to evade that and still cause COVID-19. So it really depends on, how long your immunity lasts. I would say it lasts about, 3 months or so after a natural infection. For vaccines, I think we are kind of thinking that it lasts a little bit longer, probably 6 months, based on, when Delta came around, people were kind of getting close to the 5-month, 6-month mark and had lower antibody levels. And that's why they were able to, be susceptible to Delta. And then one of the reasons why we recommended a booster at, 6 months after your second dose to protect you from, other variants like Omicron and even the future one, or even more future ones. And in terms of long-term impact on your immunity, I would say that, it's hard, again, we're early on, so it's hard to know what it will mean in the future. There is a little bit of concern of people saying that your immune system may get fatigued over time, but I don't think that there's enough information to tell us one way or another. So I would say that it's still, as long as we're still in this pandemic and there's still new variants coming around, it will still be important to follow, good masking, good public health measures, like, maintaining 6 feet from people, avoiding crowded scenarios, especially if there's like a lot of community transmission. And then, staying up to date with the vaccines that are available right now and the guidance that's in place right now. That would be the best way to protect yourself from, future strains and variants.
I know we already talked about masks, but as a follow-up question, when should we replace disposable masks?
Great question. So I would say if they're visibly soiled, like say if you're like wearing it and it's like wet and got stained or dirty, I would say that's a scenario to like replace it right away. I would say the best practice would be to try to use a daily one, because if you kind of use it throughout the day, you're pretty much like it retains all the sort of particles that you've been kind of breathing from the outside world and from the inside. So I'd say becomes pretty saturated by the end of the day or so. So I would say that that would probably be the most ideal amount of time to exchange a mask.
Should we, or is there going to be a booster shot every year, just like the flu shot, or not?
Yeah, another question that we don't know the answer to right now. There is a lot of development of a Omicron specific vaccine at this point, which I think both Pfizer and Moderna are working on. I would say it is likely at this point that may happen. So it all depends on what COVID-19 does in the next coming months. The reason why there's always a flu vaccine every year is because influenza, which is the virus that causes the flu, is a very erratic virus that kind of changes a lot because it's not very good at replicating itself. It kind of messes up a lot when it replicates. So it kind of like makes new forms. You also have to deal with, there are these two concepts with our antigenic drift and antigenic shift. Drift is more of like your kind of changes over time, replicating kind of makes mutations. You get a different strain every once in a while, usually every year or so. And then you have antigenic shift, which is when influenza, mixes with an influenza from a different kind of population, be it, birds or swine. And then you get kind of like a whole new different influenza virus. So, influenza changes very frequently, very rapidly, which is why we still get a yearly flu shot. I would say that, previously, this is pre-COVID-19, coronaviruses tended to be very good at replicating and not mutate a lot. So, there was like SARS-CoV-1 in the early 2000s, and there was MERS, which is another one in the 2000s that never reached the pandemic level of COVID-19. So I think now with COVID-19, you're getting, again, a lot of replication of COVID-19, and it is slowly evolving, as we've seen about every, early on it was doing it fairly quickly, but now we're seeing that it's happening, every 3 or 4 months or so. There seems to be kind of a new strain. So again, it depends on what COVID-19 does. If it keeps changing, that may sort of cause it to be more immune evasive or resistant to our vaccines, then we probably will need yearly vaccines. Depending on that strain. If it follows the pattern like flu that I described earlier, then we'll likely need to be sort of updating our vaccine on a yearly basis. But it's still, I think the most important thing to prevent COVID-19 to continue to change is, we really need to work on vaccinating the world, because we're seeing that, these variants come out of populations that are not highly vaccinated, either due to it not being available or just not having access to those vaccines. So I think we need to do a good job of vaccinating the world. That way that the virus has less chance to evolve and replicate and change itself, and then prevent sort of future needs for vaccine and vaccine boosters.
In the beginning of this whole pandemic, around March or so, a lot of people dealt with anxiety and they were scared. So many stores were out of stock with toilet paper. How do we prevent or avoid issues like that in the future?
Yeah, I think that probably led to like a very you know, it was a very big surprise. So I think it caught off a lot of guard, and we didn't really know how to live with COVID-19 at that point. There was, as you mentioned, we didn't have a lot of knowledge of, what COVID-19 was. We did know that it caused a pretty bad, respiratory illness and failure. But we didn't know how contagious it was, how it was transmitted, et cetera. So I think we really didn't know how to live with the virus. I think we are getting closer to a point of knowing how to live with it. Unfortunately, we've been kind of forced to learn how to live with it. But now we know that, we have an available vaccine. So I think that is definitely something that we should keep promoting, to everyone, as best as we can, because that is going to be what best protects our population for sort of big outages and outbreaks that lead to disruption of supply and of very fundamental things to our day-to-day lives. So I think promoting the vaccine, and then beyond the vaccine, promoting sort of preventative measures such as the masking, hand hygiene, distancing. I know there's like an obsession with, cleaning all surfaces and areas, because there was a worry that it was transmitted from, droplets and from contact. So, it doesn't seem that that's the main driver of COVID-19 transmission. It's mainly airborne, and floating particles in the air, making it important to wear masks, in indoor settings. And then I think the other things too is, we are experiencing a high stress in the healthcare system right now with a highly contagious, Omicron variant that was, resistant to our vaccine. So, again, I think in moments that there are these outbreaks, is kind of scaling back a little of, the amount of activity that we do. This all happened over the holidays, so this kind of just led to like an exponential growth of it. So I think we do need to have good public health policies in moments of outbreaks to kind of slow down the spread. Even though that we have good treatments for COVID-19 right now, it's still a deadly disease despite these treatments, and it also can overwhelm the healthcare system. And when there's overwhelmed hospitals, when there's reduced staff, because of like COVID-19, that leaves people, at risk in the hospital, of higher kind of mortality. So I think it's really important to follow public health guidance, in terms of, how, if we need to scale back on like indoor dining or, the sites of events that we can have. I think it's important to be flexible with that to prevent huge outbreaks and prevent a lot of transmission to the population that could lead to overwhelming the healthcare system and other kind of vital things to daily living, as you mentioned.
Hi, I have a question. So, coming from someone who lives in like a big household, if someone were to test positive, and like, how would you like suggest them isolating? But like, they live in like a small apartment, and like, they can't really have like a spare room to like isolate themselves. Like, what are your advice on that?
No, yeah, very, very important question. And yeah, it is tough, especially in a place like San Francisco where all of our, and even in the Bay Area, kind of all of our houses are small and, need to have roommates in order to live in San Francisco. So it is tough. I would say that a very important thing is that when somebody has symptoms is to have rapid tests available at home. I mean, those are difficult to obtain. There's definitely now, a federal, government program now where people can get rapid tests delivered to their households. However, if you only get 4 tests and, as you mentioned, there's big households and 4 tests it may not be the appropriate amount for certain households. So not able to get a rapid test is, still getting tested as soon as possible to first find out, because the first step is, finding out, do you have COVID-19 or not? So, when you do find out if the result is positive, then, trying your best within the household of finding one room that you can stay in. And then even then, if other family members are symptomatic and you're waiting on tests, then, that could be a way of kind of splitting up the household of, getting people together who are like had an exposure or are having symptoms while they're waiting for their test, to kind of separate them from the rest of the household. There's obviously, the bathroom situation, a lot of shared bathrooms across the city. So I think it's still okay to share bathrooms. But if somebody who is suspected to have COVID or does have COVID, it's important to kind of clean down the bathroom each time that they use it, with the high touch surfaces, just to kind of lessen the risk of, transmission there, even though I mentioned that, we don't have to be as worried with kind of picking up COVID from surfaces. And then also within that household, other measures that people can do is ventilation. So ventilation is very important for kind of getting out airborne particles that have COVID-19 kind of outside of your house and into the environment. So opening the windows across the house can be helpful too, to kind of increase that ventilation. People have filters at home, which they can also use if they would like. They may not be kind of, the hospital standard filters, but, if it's available, it's better than nothing. And then also mask use inside the house as well. Usually, or at least I suspect that for the majority of people who are at home with family and friends or roommates, they don't typically use masks within indoors. But if there is a scenario where somebody has COVID or suspected of having COVID, I think that's a good time to put on the masks until you find out more information, or if it's confirmed to be COVID-19, if that person has to leave their isolation room, to wear a mask indoors, to, if they have to go to the bathroom or grab something from the kitchen. And then mentioning kitchen, then also like kind of not eating in the same place as well. Probably trying to separate all of those activities as best as you can. And then going back to sort of when you're done with isolation, which is, what we're saying now is 5 days after you develop symptoms or have a positive test, then, repeating the test to make sure that you're negative so that you can, come out of your household sooner. However, it's still important to continue wearing the mask, because even though we didn't mention it earlier, part of the CDC guidance of shortening it from 10 to 5 days is that people will, after 5 days, when they leave isolation, is continuing to wear the mask around the house and in public too. So mask wearing will be another thing as well. So, and then in households, this is a very kind of specific scenario that I've encountered with patients is, well, what happens if everybody in the house ends up having COVID? Then, what do we do in that scenario? Do we need to keep isolating from each other? If everybody is confirmed to have, COVID-19, then, the most important thing is to isolate kind of your house from kind of the outside world, within the house. Now, if everybody were to have COVID, then you don't have to be as strict of, being in separate rooms all the time. You all will have COVID, and, you can't like pass along COVID to somebody else who already has COVID. So you can kind of loosen it in a way, in some ways, if everybody does have COVID, but definitely not a scenario that I hope that happens to people. I think the goal is still trying to minimize the spread as best as possible.
Coming from like an ethnic family, for a lot of the times when someone is sick, we use natural at-home remedies. Do you recommend that for people who have COVID?
Yeah, that's a great question. And I mean, I grew up in a house, where we always use, Vaporub in our chest to make us breathe a little bit better, and other home remedies like manzanilla and things like that. In my practice, not just with COVID-19, but with other illnesses, I say that if it's not causing any harm, then definitely go ahead and do it. I do try to kind of say to patients that, it's not going to hurt, but it also may not help entirely, and it's still important to seek care if you're getting worse. For example, if you start developing shortness of breath where you like can't catch your breath, or you're developing really bad chest pain, if your fevers are not getting better, even with using Tylenol or other remedies, still have those kind of level, or that kind of urgency to go seek care if your symptoms are not getting better, and not rely on the remedies to get better. It's also important to chat with, if you have access to, a primary care physician, because there are now some treatments that we can give patients with COVID, outside of the hospital. A lot of the treatments were kind of restricted to the hospital, but now we do have some antiviral pills that can help, that were recently authorized by the FDA. But usually getting access to that medicine involves chatting with your doctor, making sure it's the right medicine for you or the right decision, and then prescribing it to somewhere. So I would say, I think I have no problem with people using home remedies to make them feel better, but just remember that if you're not getting better and you need more attention, to call your doctor for more information.
I have just one last question. A lot of people don't have access to tests for COVID. Like in a lot of places, at-home tests are sold out, or they don't know any information about where to get tested. What do you recommend when you're in that situation?
Absolutely. Well, it all depends on, where you're at. Maybe just speaking to, San Francisco itself, there are several community testing centers that do have COVID tests. Just down the street from you all, there is the testing site at 24th and Cap. Obviously they have, they're not there every day of the week. They're mostly there, if I remember, from Thursdays and through the weekend. So that's a good place to go to get rapid tests where you get same day results. Also looking online, which again means that you have to have online access, so not very accessible, is looking up through, California Department of Public Health or San Francisco Department of Public Health to look for a list of, places that offer free COVID-19 testing. That's kind of like the best that I can do. And also kind of in discussion with your doctor, if they can order a test for you to their healthcare system to get tested sooner. So those are the main things that I mentioned to people. Usually look up with them and find a place and see what works best for them in terms of hours, and if it's close to where they live. That's what I typically do with patients, but it all should be available online, looking through the Department of Public Health.
All right. Did anyone have any last minute questions or? Awesome.
I just wanted to say thank you to Dr. Rubio for coming in and teaching us about this stuff. I think that's super important, and yeah, thank you for giving your time with us and sharing with cool information.
Yes, thank you so much.
Thank you so much. A lot of people don't have this information or don't have access to this information. So I think it's great that you're able to be here with us and share this with us.
Absolutely. I mean, thank you all for having me. I know it's after school for you all, so I appreciate you all staying an hour after school to chat with me. And I'm always happy to help. And as you say, it's important to disseminate this information for people who need it.
Thank you.